Every year, people come in contact with various gastrointestinal diseases. Bacterial diarrhea is one of the most highly communicable of these diseases. The effects can be quite severe and sometimes include fever, nausea, and abdominal cramping. Some specific names you may have heard about are E. coli, Salmonella, Giardia, and Campylobacter.
And these diarrheas are the ones that I tend to get as your public health nurse. They are reported from your doctor to the state, and then I get a confidential case report form, which I then follow up. I do this as one to be able to do an educational piece with the patients, but I also do it to be sure that there is no outbreak of these contagious diarrheas. In the year 2007, Tewksbury had 7 cases of Salmonella, 2 cases of Campylobacter, and 1 case of Giardia. In 2008, there were 10 cases of Salmonella, 3 cases of Giardia. And in 2009, there have been about 8 cases of Salmonella, 2 of Giardia, and 4 of Campylobacter. As you can see, these numbers increased, and the reason being, I think, is people are not aware of the contaminants.
People are most at risk because of the foods we consume. Coming in contact with unpasteurized milk, raw eggs, and raw meat puts us at risk for contracting these illnesses. When preparing a meal, it is important to keep your raw meat separate from your other ingredients. It is important to wash your hands, cutting boards, and countertops after cutting meat. By following these simple steps, we can prevent cross-contamination and can decrease your risk of becoming ill.
And if you're in a restaurant, you have the right to ask the people to send it back and cook it well done. A lot of restaurants now will not serve food that is not well prepared. Also, people that are food handlers, it's very important if they are sick that they stay at home with a diarrhea until they are cleared that it isn't bacterial. And for them also, it's very important to do the hand washing.
These illnesses can be spread quickly, especially from person to person in restaurants and daycare facilities.
Household pets and petting zoos are other possible sources of infection. It is important to practice proper hand washing.
You need warm running water with a lathered soap and enough soap to build up. You rub your hands together to cause friction and rub between your fingers and do your thumb, top surfaces and bottom surfaces of your hands.
In a public restroom, after properly washing and drying your hands, it is important to use the paper towel to both shut off the faucet and to open the door as you leave.
Touching community sinks and door handles are prime breeding grounds for bacteria. It is very important for adults to wash their hands and to teach their children to do so also. Important things to remember are: wash your hands and wash them well. Don't cross-contaminate your foods, and make sure your foods are cooked thoroughly. Good luck and happy hand washing.